Embryo reduction is used when the mother is pregnant with more than 2 embryos and when a risk arises, for her as well as for the babies. We will explain to you what are its main indications. Embryonic reduction is an intervention that is being carried out more and more. This is a technique that involves reducing the number of fetuses during multiple pregnancies. In other words, in women who are expecting twins, triplets, or quadruplets. The reason it is realized is that multiple pregnancies carry a much higher risk than pregnancies of a single fetus. They can negatively affect the mother or cause complications in babies. The intervention therefore increases the chances of a successful delivery. Here we will explain to you what embryo reduction is, how it is carried out and how to face this decision. What does embryonic reduction consist of? Before explaining what embryonic reduction in itself is, we need to contextualize a little in order to understand why this technique is necessary. A multiple pregnancy is a pregnancy in which 2 or more embryos end up in the maternal uterus. These embryos can come from the fertilization of 1 egg, monozygous pregnancy, or 2, dizygotic pregnancy. In other words, multiple pregnancy is where the woman is expecting twins, triplets, quadruplets or more. Multiple pregnancies have greater morbidity and mortality, both for the mother and for the embryos. Maternal complications are estimated to be between 3 and 7 more common than in single pregnancies. This is why, sometimes, risks cannot be taken. It is preferable to proceed with an embryonic reduction. Multiple pregnancies frequently appear after resorting to assisted reproduction techniques. This only increases the problem as the decision is more complex. Embryo reduction is also known as selective termination of pregnancy. It consists of the interruption of the development of 1 or more fetuses, in the context of a multiple pregnancy. It is a technique that is recommended when the risk is very high, both for the mother and for the babies. The idea is to improve the conditions of pregnancy so that, at a minimum, 1 or 2 healthy fetuses can be born. When is embryo reduction recommended? Embryo reduction is recommended in high-risk multiple pregnancies. In general, it is used when it involves more than 3 embryos, triplets or quadruplets. Indeed, the pregnancies of twins or even triplets do not suppose a great risk if the mother is in good health. The risk increases in real-life situations, such as when one of the fetuses is stunted in intrauterine growth. The reduction is also done to avoid premature delivery. Another reason why this technique is recommended is to avoid cardiovascular complications in the mother. Likewise, we try to prevent bleeding and rupture of the lining of the uterus. Even if this point is more complex, it is possible that it is the own family which requires an embryonic reduction. Especially in cases of economic hardship. How is embryo reduction carried out in a multiple pregnancy? Embryo reduction is a procedure that is usually done early in pregnancy. It is best to use it between week 10 and week 13, after the first ultrasound. The main reason it is not realized before is that there is a possibility that the embryos will shrink in the first few weeks. Also, until week 12, some ultrasound features cannot be assessed. For example, the nuchal fold or the heart rate. These parameters are those that suggest a high-risk pregnancy. It is also during these weeks that we determine whether the fetuses come from the same egg and whether they share the placenta. Embryo reduction is a procedure similar to amniocentesis. It is usually done under local anesthesia. 2 routes are possible, vaginal and abdominal. A needle is inserted through one of the 2 until it reaches the fetus that you want to reduce. To achieve this, an ultrasound is performed at the same time, which helps guide the needle. Once the fetus has been reached, a solution of potassium chloride is injected into the chest. This substance causes the fetal heart to stop. After that, it will be reabsorbed by the tissues of the uterus, so there is no need to extract it. How do you choose the fetus to reduce? There are 2 types of embryo reduction, whether or not you choose which fetuses you want to eliminate. The first type is selective reduction. It is preferred when one of the fetuses is already showing features that indicate abnormalities. For example, congenital defects or a developmental deficit. The idea is to shrink this fetus because it will be the one with the least chance of survival. The second type is non-selective reduction. In this case, it is done without choosing a fetus. We reduce the one for which the introduction of the needle into the thorax is simpler. Possible risks of the technique. Embryo reduction is a safe technique. The rate of total pregnancy loss is between 5 and 6%. And, if this technique is not used, the spontaneous abortion rate is higher. In addition, the risks to the mother and the surviving fetus vary depending on when the reduction is performed and whether the fetuses share the placenta. Either way, embryonic reduction increases the likelihood of survival of the rest of the fetuses. Indeed, it allows them to have more space to develop and improves their nutritional capacity. Risks exist despite everything. There may be bleeding and intra-amniotic infections. In addition, childbirth takes place before week 37 in almost 75% of cases. We must also not overlook the fact that embryonic reduction can have psychological consequences for the mother. It's a tough decision. Embryo reduction is a difficult decision for all parents. It is normal to want all of your children to be born. This is why parents always have doubts and wonder if this is the best decision or not. In other cases, the decision is made for external reasons, such as economic issues. This intervention is therefore stressful, complex to assume and has a great emotional impact. It is therefore always recommended to consult several specialists. Managing the situation with a psychologist can also be beneficial. While embryo reduction has medical benefits, it is not without risks. Embryonic reduction mainly entails a risk of miscarriage, loss of all embryos, occurring quickly or later. This risk depends on the initial and final number of embryos and when this technique is done. The later the is performed and the more risk there is, the more embryos there are and the higher the risk, informs Drive Galat. The risk of miscarriage is estimated to be 4.5% for an initially triple pregnancy, 8% for quadruple, 11% for quintuple and 15% for pregnancies of 6 or more fetuses. Other possible complications but much less frequent, hemorrhages and infections. In addition, embryonic reduction is an act that can have serious psychological and ethical consequences for the family, the couple and the surviving child or children, but also for the medical profession. All published studies stress the need for psychological support before and after embryonic reduction. Embryonic reduction takes place in the first trimester of pregnancy, often between the 7th and 9th week of pregnancy. It takes place under general anesthesia and ultrasound. We select an ovular and embryonic pocket and we inject with a needle a toxic product for the cardiac activity of the embryo, explains the doctor. This is not an aspiration as during an abortion and the ovular sac is not destroyed, it is reabsorbed on its own. Embryo reduction is not without risk. There is a risk of miscarriage of other embryos in 5 to 10% of cases because, as we cross the uterine muscle, there may be contractions, hemorrhage, says Dr. Brahmi. Embryo reduction is very difficult for parents, so psychological counseling is recommended. Embryo reduction is not a success, neither for the parents, nor for us, it is a problem, underlines Dr. Brahmi. Finally, it is important that the family benefits from the support of those close to them. The opinions of other parents who have experienced the same situation can be of great help.